Fear of death versus reality in kidney disease. Welcome to Health Talk, made simple by Aziz. Today we're talking about a very heavy fear. It's a fear that can settle in your heart and mind the moment you hear four specific words. The fear of death after hearing the words chronic kidney disease. For many, this diagnosis feels like a final verdict, a countdown clock that has just started ticking loudly. If this fear has touched you or your family, please know you are not alone. This episode is for you. Let's slow down and talk about it calmly. Let's separate the fear from the facts and replace anxiety with understanding. First, what is kidney disease? Simply put, your kidneys are powerful filters. They clean your blood, remove waste and extra fluid, manage your blood pressure, and help make red blood cells. Chronic kidney disease, or CKD, means your kidneys are damaged and can't filter blood as well as they should. But here's the most important part. This is almost always a gradual process. It is not a sudden event. Kidney disease is measured in 5 stages, based on how well your kidneys are working. Stage 1 is the mildest, where there's some kidney damage, but they still work well. By stage 5, the kidneys have lost most of their ability to function, which is known as kidney failure. The journey from the early stages to the later ones often takes many, many years. This timeline is not set in stone. It's a path you can influence. The diagnosis is not an endpoint. It is a starting point for taking control. Many people hear kidney failure and think, I am going to die soon. This is the single greatest misconception we need to correct. I've seen this fear many times with patients and families. I remember a gentleman in his late 50s, a grandfather who loved gardening. When he was diagnosed, he immediately pictured himself unable to play with his grandkids, becoming a burden. He told me, "Doctor, just tell me how long I have." His world had shrunk to that one question. Some people stop listening after the diagnosis. The words kidney disease are so loud that they drown out everything else the doctor says. The plan, the hope, the path forward. Some feel frozen. Some feel hopeless. They fear the unknown. They fear dialysis. They fear losing their independence. These feelings are completely normal. It's okay to feel scared or overwhelmed. Acknowledging these emotions is the first step toward managing them. But this fear usually comes from misunderstanding what kidney disease means in the modern age of medicine. It's a fear rooted in outdated information. This fear changes behavior, and this is where the real danger lies, not in the diagnosis itself, but in how fear makes us react. People may skip appointments. They may stop medications. They think, what's the point? But every missed appointment, every skipped pill, is a missed opportunity to slow the disease down. Fear steals energy. Fear blocks learning. Fear takes away hope. It prevents you from hearing the good news, that you have a tremendous amount of power to change your outcome. But fear is not the truth. The truth is that you can live a long, fulfilling life with kidney disease. Let's look at the evidence-based outlook. For the vast majority of patients, the progression of kidney disease is slow, unfolding over years, and often decades. It is not a runaway train. With today's treatments, we can apply the brakes. We monitor your kidney function with simple blood and urine tests, like the GFR, or glomerular filtration rate. This number tells us how well your kidneys are filtering. By tracking it, we can see how you're doing and adjust your treatment plan. Kidney disease is usually a slow process. It does not mean sudden death. Many people live years with kidney disease. Some live decades with proper care. The goal of treatment is not just to manage symptoms, but to protect your kidneys and slow down any further damage. So, let's build your action plan. This is how you take back control. Think of it as a partnership between you and your healthcare team. Your part is crucial. First, medications. These are your shields. Blood pressure pills, like ACE inhibitors or ARBs, are kidney protectors. Diabetes medications are vital if you have diabetes, as high blood sugar is a major cause of kidney damage. Take them exactly as prescribed every single day. Use a weekly pill organizer or set phone alarms. Don't stop them without talking to your doctor. Second, diet. This isn't about punishment, it's about precision. A kidney-friendly diet often means lowering your intake of sodium, potassium, and phosphorus. Reducing salt helps control your blood pressure. Your dietitian is your best friend here. They can help you create a plan that is both healthy and enjoyable. Third, fluids. Depending on your stage, you might need to watch your fluid intake to prevent swelling and strain on your heart. And fourth, appointments and labs. These are your check-ins, your progress reports. Keeping these appointments allows your team to catch any changes early and adjust your plan. Consistency is what saves kidney function. Consistency saves lives. Every pill taken, every healthy meal chosen, every appointment kept, it all adds up. It is the foundation of a long life with CKD. Take medications, follow diet advice, manage fluids, keep appointments. This is your core four. Now, while kidney disease is a marathon, not a sprint, there are times you need to act quickly. It's important to know the warning signs that require immediate medical attention. Call your doctor urgently or seek emergency care if you have severe shortness of breath, which could mean fluid is building up in your lungs. Chest pain, as kidney disease can strain your heart. New confusion or fainting, which could signal a serious imbalance in your body. A fever or chills, which might indicate an infection your body is struggling to fight. Or extreme weakness that prevents you from your daily activities. Knowing these red flags isn't about living in fear. It's about being prepared and empowered to act when necessary. Finally, you cannot do this alone. Build your support system. Talk with your care team, your doctor, nurse, dietitian, and social worker. They are there to help you. Include your family. Help them understand the disease so they can support you without fear. And most importantly, ask questions. Write them down before your appointments. Ask, what stage is my kidney disease? What is my GFR? What is our goal for my blood pressure? What can I do today to help my kidneys? Kidney disease does not mean immediate death. It is a manageable, chronic condition. Remember that gentleman, the gardener? We worked together. He started his medications, met with a dietitian, and began monitoring his blood pressure. He is still gardening. He is still playing with his grandkids. His life is full. Treatment plus knowledge creates time. Hope lives in understanding. Take this knowledge, talk to your doctor, and take that first step on your path forward.